So we talked about prevention before, and my belief that prevention really truly is the way forward and what we can. No, there's lots of opportunities in this area, but we just heard there's lots of challenges, in the traditional healthcare system, right? It's just the incentives are just not there. It's everything is skewed towards keeping people sick and treating sick people. And so there's a lot of challenges when we talk about prevention, or longevity is a new topic, which is very heavily discussed at the moment. So how to extend healthy lifespan at the end of the day. And so we are in that particular field where we work with clinics, we work with healthcare professionals who are outside of the traditional system with insurances and so on, where people essentially pay out of pocket to optimize their health. And there we can see that a lot of things are really interesting and possible and on the health optimization side. And so today I want to show you a little bit about what we do specifically. So we work with health data. The difference between sick care, as I say, so when you have a broken arm, you have a broken arm. That's pretty easy. But if you want to optimize someone's health, we always need to talk about data, because we always need to understand what's happening in every single one of you, what's happening in your body, because everyone is unique. Everyone has different genetics. Everyone has different biomarkers. Everyone has different lifestyle, has different ways to eat. Diet is different. So we really need to understand what's going on. And so I want to give you an example of how this can look like in practice and what we do. And then later, actually, we're going to have the opportunity to hear from someone that we worked with. I don't want to say a patient, but I want to say someone that we help to optimize on how this really looks like, and what really the difference can be when you use data-driven health optimization. So I want to start with showing you my perspective or my view of what I believe is wrong with the healthcare system today. And I want to show you a little video which was secretly recorded last year in Italy that really shows why the system is broken. And because this video was recorded without people in the video knowing, then please don't take any pictures or don't share anything, because it's might get us in trouble. So here we go. Oh, it's not showing. So sorry. Okay, so this is a little bit just moved around for whatever reason. Let me replay that, and the joke is kind of ruined now, but let me do this again. Well, it's always great when you have to repeat a joke, but yeah. Yeah, so obviously this is me and my middle daughter in Italy in one of those play saloons, but this is essentially how we do healthcare today, right? So we wait until symptom pops up, and then we hit it with a hammer, usually pharmaceuticals. Then we wait until the next symptom pops up, and then we hit it again. And then we get side effects, and then we hit it again. And this is what we do, and this is how all of our healthcare system is really built. And if we talk about prevention, it's great, and people always say, yes, of course, we all know prevention is great, and now we technically also we all know how to stay healthier. Now the big four things: take care of your diet, take care of your movement, take care of your mental health, take care of your sleep. That pretty much covers 80% of what we can do. But really, when we talk about personalized health optimization, there's a lot of more things that we can actually do, and that we can actually do to optimize. And so our platform that we've developed, the Biological Nexus platform, helps providers who focus on prevention, typically, or high-end wellness clinics, for example, longevity centers, to use the great amounts of data that we have to optimize health. And that data is genetics, that data is biomarkers, that data is wearable devices. And we can really do a lot of things with that data. But instead of kind of walking you through the platform and boring you, I want to show you a real example of how this looks like in practice. And it's actually someone that we worked with in the past. Of course, we changed the name, we changed the data a little bit. That what I'm showing you is real world data, and so it's a real case study. So the person we're going to talk about, let's call him Bob. He's a middle-aged manager, very successful investor, family man. So like a lot of people here in the room. But Bob has also developed something which is called metabolic syndrome. And metabolic syndrome is not a specific disease, it's more of a cluster of different symptoms. It's like you're fatigued, your blood lipids are out of whack, cholesterol, high fasting glucose, typically you're pre-diabetic, high blood pressure, so all these different things. And it doesn't kill you immediately, but what it does, it puts you at way higher risk of diseases late in life. Diseases such as cancer, diseases such as neurodegenerative diseases, heart attacks, diabetes, and so on. And why this is really relevant is that statistically, if you look to your left and to your right, 1 in 3 people between you are going to develop metabolic syndrome if you don't already have it, right? Because it's one of the most common chronic diseases that we see. So it's really something that affects a lot of people. And the question now is, what do we do about that? And typically, the answer is no, you give medications. So you put them statins, beta blockers, blood pressure medications. And that was the case here. And now, over time, things have declined. And so he was supposed to be put on more medications. And now, if you're mid-40 and you're popping pills like an 8-year-old, that's not really fun. And also, if you take more medications, really that means more side effects, right? So all the wonderful things from issues with your liver and for the man, erectile dysfunctions and constipations and all these things. So it's really a situation you don't want to be in if you're in your mid-40s. And Bob also said, no, that's not something I really feel comfortable with. So what's an alternative? And he knew some of the doctors from our clinical team, and we discussed alternatives, and we talked to his treatment team, and they said, look, okay, we're going to give you 2 months to do something. Let's do an experiment. If that doesn't work, he's back on more medications. So that was the outcome. So we said, okay, let's try it. And typically, how does a doctor see you, right? And the question is, how can we look at healthcare differently? So typically, your doctor looks at you like that. So you're a bunch of lab reports, and unless you're in the medical field, it's very hard to follow what they're even talking about, right? So you cannot really be involved if you don't understand what all of that means. So you're not just numbers, right? And so the first thing we did was we just took all these labs and in our platform, what we typically do as a first step, we take these labs and we try to make them more accessible. So we try to show them in a way and present them in a way where people can understand, okay, so my blood lipids, 3 times too high, chronic inflammation markers 10 times too high, and blood pressure was through the roof. So really what we could see, the first thing was that was someone who's really on a trajectory to a very bad health event in the next few years. What else can we do? So the next thing we need to do is look at, are we looking just as a snapshot and just something wrong at the moment, or has this been going on for a while? So by looking at the longitudinal data and visualizing that data, we could also see that was an issue that was persisting over many months and years. And so it was clear that we needed to do something to change here. Then typically what a doctor does, they look at medications. So we're tracking the medications that someone is taking at the moment, medications that someone is taking right now, medications someone has been taking in the past. And those 2 things are typically where traditional treatments ends, right? So that's typically all your doctor does. They look at lab values and they look at your medications and they give you more medications. That's pretty much it. But there's more data that we have about health that we can use. And one of these data points is genetics, and typically genetic report looks something like that. So it's now, unless you're geneticists, you really will not understand what the hell people are talking about. But genetics give us really great insights about like the blueprint of your life, because it helps us to understand where are potential issues in your life, where are things we want to have a closer look at. So what we do is we use then algorithms to look at the impact these genes have on certain pathways in your body. So, and we could see clearly that for that person, for Bob, there was a genetic which was high impact on inflammation, on detoxification. So there was some genetic issues with liver. He was missing some enzymes, for example. We could see there was some genetic risk factors around cholesterol. So that was pretty fitting to his actual conditions. So that's one thing we can do. What else can we do? We can look at lifestyle. And nowadays, a lot of people are using wearables like the Apple Watch, Garmin, Oura Ring, Fitbit, something like that. And we can use that data to track lifestyle. And what we could see clearly was, by tracking him for a while, that he was living a very sedentary lifestyle, not moving enough, not getting enough steps in, sitting in the office all day, sitting on the couch in the evenings. So it was clear that we have an issue around lifestyle and movement. What else can we track? We can track nutrition. Nutrition is notoriously hard to track, but everyone has a phone in their pocket, so we can use that phone, which is also then connected to the platform, to track the nutrition, to run algorithms on, at least on a rough basis, macro and micronutrient profiles. So we could see in his case, clearly he was eating a very bad diet, too many sugars, too many simple carbs, and not enough good fats. So that was another issue that we were seeing. Now, what do we do with all of the data? One thing that's becoming more and more common are so-called aging clocks. So aging clocks compare your actual chronological age, so I'm 40 years old, for example, with your biological age. So how much faster are you aging than you actually are? And of course, if we smoke, if we drink too much, if we eat unhealthily, we're going to age faster than we should. And of course, we can reverse that. If we stop smoking and eat healthy and move more, and have the right lifestyle, then we can reverse this process. And a lot of clinics use that to track people. But where it really becomes interesting when we start combining all of the data points together, and that's what we do in a platform. We look at the combination of genetics and of biomarkers and of lifestyle data, and of supplements and of medication, and that shows us. Imagine like the dashboard you have in your car, where the engine light goes up, or it's time for an oil change. We can use the data to point towards the areas that we see, where we can, not only where we have issues, but also where we know that based on genetics, we have high impact factors that allow us to change things relatively quickly. And there's a lot of things, I'm not going to bore you with all of the detail, but really in this case, what we could see there were three main areas where we were seeing issues, but where we also knew from the genetics and from studies based on genetics that we can change things pretty quickly here if we do the right things, right? We just need to pick the right things to change, and then we expect a quick change and a quick result. And so that's what we did. We focused on these three areas. And what does it mean, right? Now that we know the unique health situation, we need to do something, right? We need to optimize something. And now, there's a million things you can do if you have the data. Now, you can change the diet, you can change supplementation, you can change lifestyle, you can do very specific things that we know. Genetics tell you a lot of things on, what specifically someone is lacking. For example, I know, for example, in my case, I was always wondering. I was taking high amounts of vitamin D, 5,000 IU a day, which is around roughly 12 times the amount that's recommended, at least in Switzerland. Every time I checked my levels, I was in the lower end. When I did my first genetic test, I found out I have a genetic peculiarity where I just need more vitamin D, for example. So I need to actually way over supplement, and any doctor would say we're taking way too much, but that brings me in an optimal amount, right? So we can understand what are the things that for that person is specific, but of course no one's going to change 50 things at the same time, right? No one changes. Even just two things are hard to do, or three things. But based on the data, we can pick the things which we think are the most impactful. And so in that case, we selected a few things, very simple lifestyle changes, very specific though, in diets, very specific supplementation recommendations, and we implemented these changes with that person. And if we say we, by the way, I didn't mention that, so we are a software provider, health data provider, but we have a clinical team. So we have geneticists, we have medical doctors, we have dietitians, we have functional trainers, we have health coaches, and almost like to prove what we do, we also work with some people directly, so that we can also have some real world experience. And now, what changes did we do? So, for example, we radically changed the diet. Removed pretty much all the carbs, put him on a very high fat diet. We made sure that he's getting more movement, getting more steps in. So initially he had some issues. For example, he didn't like sport because his knees were hurting. So we supplemented certain things that made him feel more comfortable when moving. And we added supplementation, some other lifestyle changes, and the results that we achieved were really amazing. So within 8 weeks, chronic inflammation went from 10 times too high almost to normal. Blood lipids, triglycerides, cholesterol stabilized within 5 to 6 weeks and normalized within the time. He was pre-diabetic before, that almost immediately went back to normal. Some issues around liver and detox that also stabilized within a few weeks. So essentially, just doing very simple changes. I mean, it's not rocket science, right? It's move more, it's take some supplements, to change your diet, but specifically to what we know about that person really had an amazing impact. And what's great is that we took someone who was really close to probably a heart attack or some stroke or some other chronic condition within 2 months to someone who really is now, even quite a while later, stable. So pretty much everything has stabilized. He's off most of his medications, really living an active lifestyle, lost 15 kilograms. So really the changes that we've been seeing are really, truly amazing. And that's what I believe is the power of really using data-driven health optimization on lifestyle. Because if we would do this with more people, we could prevent a lot of these chronic conditions, and we could prevent a lot of other things. And we always say yes. We know, prevention is great. And just talking about cancer, I mean, who of you, know someone who has cancer or had cancer or lost someone from cancer, and like pretty much everyone in the room, right? And so we say, yeah, well, cancer is one of the biggest killers that we know. And the Lancet journal, which is one of the most prestigious medical and scientific journals, they did a study a while back that looked at what percentage of cancer could we prevent just with lifestyle changes. So which percentage of cancer is not driven by genetics or by environmental factors, just changing lifestyle. And what's your guess? 2%, 3%, 5%? And I guess so it's actually 44%. So actually, even today, we could prevent every second cancer just changing lifestyle. Very simple things, and we're not doing it. We're focusing on giving people medications. We're focusing on people and on treating people over many years, because, as I said initially, the incentives in the system are wrong. But we could do so much better as a society, as healthcare systems, if we would actually use the data, work with people directly, work with optimizing their health and adding healthy lives to their life. And that's what we are committed to. So now I want to switch over because we actually have another person in the room on Zoom, not in the room, who we worked with. He is Martin Weiss. He is the CEO of Infosys. Infosys is, for those who don't know, one of the largest global IT providers. They are the largest outsourcing partners for Roche, for Novartis. So, Martin knows a thing about healthcare, and we also work with him, or have been working with him for a few months now to optimize his health. And maybe, Martin, can you hear us well? So
yes, I can.
Give a little bit of an applause, Martin, for showing up. And we just want to ask you about your experience and how, like, a data-driven, approach to your health has helped you, has changed your life. Maybe you can tell a little bit where you were coming from and where you're now, and the changes that this has, impacted you in your life.
Happy to do so, and good morning, everybody, and good to see such a big crowd interested in longevity and improving your own health. Yeah, so I started the journey in November last year, and a trigger was, I'm a management consultant, working consulting since 20 years, and with every year in consulting, you gain basically 1 kilo of weight. So this is the downside of the job. It's a lot of whining and dining and hard work and late shifts, and also late dinners and not enough sleep, and usually the dinners you take in a hotel, and this is really not good for you. And exercise is also coming along short. And this was then really something. After 20 years, I decided, look, I can't go on like this because this job is tough, and if I really want to perform at my best, so I really need to improve my health situation. So I started to talk to Biolytica and to be part of the AIM program, so really a concierge service, where we started to take my genome sequence last November, and based on the results, we started to really then also look into my diet, look into my exercise behavior, look into maybe also some supplements I need, maybe also some medication, because my cholesterol was quite high. So I started the journey, and the journey was really a very interesting journey, because I learned so much, not only about my own health situation, but also about the health situation which is caused by my genes, so also by my ancestors, and also my risk profile towards certain things, but also my opportunity profile, let's say, let's call it like this, just because I learned that with very little exercise, so I do every other day, I do 20 minutes on a cross trainer, so I can really improve my personal fitness. I changed my diet, so I'm doing intermittent fasting. I changed my diet to a more Mediterranean diet, not so much meat anymore. So I changed and became a barbecue vegetarian. So I only eat meat when I do barbecues. And I look really into better sleep, the right amount of exercise, the right amount of food intake, not so much. I just ate too much. And it all then went back and forth, and we did a couple of blood tests. I'm looking into all my variables nowadays. So this all goes into the platform, in the Biolytica platform, so which is really giving me insights and giving me a day-to-day KPI dashboard. I'm a business guy, so I love KPI dashboards. And it really gives me good insights into behavioral change I need to do. And maybe also when I need to, do a bit more exercise, I see it on the platform. So it's just because it's a bit like a balance sheet. So you can take out money, you can take in money. So when I see that I ate too much or I did not do enough, I did not have enough sleep, then I see I have to do more exercise. So this is really something which helped me improve my own health situation. I went down by 10 kilos. My cholesterol level is as it should be, so in perfect stable state. And everything else is really improving. You can see it in your blood markers. You can, but also see it in your personal fitness. I have 3 little kids, and there's a lot of exercise with the kids as well, and that really helped me a lot. So all in all, it's a journey. I'm 6 months in now, and really enjoy it, and things really improved.
Thanks for sharing that, Martin. And so maybe to make one comment, because one criticism we're always getting is, so what are you doing, right? You're exercising more, you're changing your diet, so what's so special about it? The thing is that, of course, if you improve your diet and if you improve your training, everything, of course things will change, that's clear. But where the data really helps us is finding out the right way to exercise, for example, or the right way to eat, because not everyone should do training 5 times a week. Some people should only train once a week because they don't have the genes for recovery, so that they need longer to recover than other people. Some people actually need a daily training input because they recover very fast. Some people are more on the strength side, on the power side. Some people are more on the endurance side, for example. So that's one of the things you can find out and that you can optimize together with the data. Same on the nutrition side. It's of course, if you go from a very bad diet, not saying, Martin, that you had a very bad diet all the time, but just if someone had a bad diet, then and if you change it to a good diet, of course you will see an impact. But what is the right diet, right? A low carb diet is not right for everyone. A vegetarian diet is not right for everyone. A meat based diet is not right for everyone. So it's the difference is in not only optimizing by living better. Yes, of course we all know that, but really finding exactly what is right for every single person, and that's where the true potential is. And maybe Martin, how long did your wife try to get you to lose weight before we started?
Yeah, since we know each other since 20 years. And the thing is, with the exercise, for example, so I have a very busy schedule, and I thought I can't go to the gym for 1.5 hours every other day. That is just not working for me, just because I have so many commitments. Yes, from a business perspective, and then with looking into the Nexus platform and then looking into the right level, the right balance of exercise, I really found out it's just 20 minutes. And that's easy to wave into your busy schedule. So I can do this in the morning instead of having breakfast because I'm on intermittent fasting. So it really goes along quite well. So I do this 20 minutes and it's really easy to do. Yeah? And before that, I always thought I need to go to the gym for 1.5 hours or it's totally useless, but it's not. Yeah? So because all the data gives me the insights that 20 minutes is good enough.
Yeah. And that's really, I think, the interesting part of things. So definitely we would love to see this more implemented on a wider scale. I mean, we're also talking to big companies, pharmaceutical companies, how we can better use that data. But of course, it's a very long process and it's very tedious, and the incentives are just not there in the system. That's the problem. And I believe personally that, and I talked to a lot of people about, can we change the existing healthcare system and can we move it more towards prevention? And honestly, I don't think we can. No chance. It's just not incentivized. So I think the only thing we can do is to kind of almost build like a system in parallel, which at the moment, of course, is driven by people who invest their own time and money into doing these things. But if we can do that on a larger scale, if we get more and more people excited, and right now there's lots of discussions around longevity, especially in the US, lots of money is flowing into the field. So if we can get more and more people to do that and to live healthier, and we can show that by these very cheap and simple changes, we can actually have a massive impact on health on a wider scale, then I'm sure there's going to be a point where if there's a system in parallel that works better, people will start to jump over, and also the industry will understand that, hey, actually, those guys are doing a better job at lower costs, and from a population perspective, that's actually the better solution than to do that. So Martin, anything you want to say about maybe your insights? So of course in the group here today we have lots of people from different companies in the health area. We've heard a talk about health data before. We have some clinics here from some private clinics. Any comments you want from your perspective as Infosys? I mean, you as I mentioned before, you're one of the largest global providers for Roche, for Novartis, for IT. So what are changes that you see in the healthcare system or in health in general that might be interesting for the audience here to see and learn about?
So I think everybody's talking now about generative AI, as you can imagine. Yeah? So I think AI, let's say the generative AI hype is now making AI accessible to many people in the society. So where everybody understands the art of the possible. And I think this will give a major push to also kind of personalized medicine studies where people are more open to participate, and then also that the industry is then also moving into this personalized medicine, let's say, pathway, just because I think prevention is one thing, but the right medication is also another thing, which is, I think, really very specific. I see it now in my personal case with the cholesterol. It was not only changing my diet, so I also took some classical medicine, so to really reduce my level of cholesterol. And but with all the data, my doctor back here in St. Gallen, she was just amazed how much data I have just because I use the platform. She says, hey, we can then be very specific, and when you are on your path, changing your diet and exercising more. So let's really monitor the cholesterol level very closely. And we were then, over the past 6 months, we were really reducing the amount of intake. There's a little bit of personalized medicine, amount of intake, just because I had so much and so good data available. And I think this is something in combination with personalized medicine from the big pharma players, which is driven by AI algorithms in the future. Maybe something I would see that we will make strong progress. And I think we will not see the classical 10 milligrams, 20 milligrams here in 10 years from now. Yeah? So I think this AI hype driven by generative AI, because now everybody knows it, so will really change the picture. And I hope for the good that then personalized medicine will also make medicine more available so around the globe. So because we live in Switzerland and Germany, so it's easy to get your medicine. But if it's really rare, and if the supply is not that secure, then I think personalized medicine can be a way out of so kind of a shortage of medicine also for some emerging countries and some third world countries.
And what are other use cases of AI that you see? And as Infosys, you're obviously implementing a lot of that. Can you give some examples? Because I always find it very interesting how, we all know ChatGPT, and it's interesting to play around with it and get some nice answers. But what are other practical use cases how AI is being used in the field of healthcare?
Yeah, let's start with clinical trials. Yeah? So this is the beginning, or let's say it's a major part of the R&D process in the pharma industry. Clinical trials, there are good platforms like Sistra AI, so which are now providing a more data-driven platform to really manage clinical trials, to create synthetic data as well, so that you don't have to take in 250, 300, let's say, candidates. You can reduce that just because you can then work with the algorithms and with the data you have from other clinical trials. So this is one movement. So I see strong a lot of startups also in the field of clinical trials and how to use AI for clinical trials. Yeah. So, and then, there are very, very basic and classical things in the healthcare industry. All the documentation you have to do as a doctor. So writing down the ICD-10 codes, for a diagnostic. Yeah. So can be then also enabled by generative AI. For example, so we do use generative AI now for big companies like Pfizer for really creating documentation and summarization of documentation needs in the healthcare industry. Think about pharmacovigilance, so where you have to do all the reporting. This is heavily AI enabled, and I think the generative AI is really a game changer here. Yeah.
I know we're supposed to do Q&As at the roundtables, but since Martin will not be with us here, are there any questions from you that you want to address to Martin with regards to either AI-based topics, IT topics in healthcare that you want to ask? No. Oh, yep, just one. Sorry, he's coming.
Hi, my name is Ronald Vollebrecht. I'm working with Amgen, also a pharmaceutical company. You were mentioning that the development phase is really changing, but a really important element there is also government and regulators that need to accept new technologies and things like that. What is your take? What you see happening around the world and maybe specifically in Europe?
Yeah, specifically in Europe, unfortunately, we are going the risk-adverse way in the regulating AI. So what we see is we do have, with the EU AI Act, which has just been released, so we see a more risk-adverse, let's say, way of handling things. And this is something where I would say we are running into a classical dilemma that some pharma companies will move over to the US or maybe also to India, so where to do more R&D research using AI just because it's so heavily regulated here in Europe. This is creating really a dilemma, because what we will see is an adverse selection that, some companies will stay in Europe but will have a competitive disadvantage. Some companies will move over to other places in the world to do their R&D research. So I think if it stays in kind of a more block-wide European, US, Asian regulation of AI and using AI and using new technologies, so I think we will see a competitive disadvantage here in Europe. So running a business, unfortunately.
Thank you, Martin. Any other questions? Good. Martin, then maybe just as last question to you, being also the head of Europe for Infosys on the topic of AI. We've been playing around with AI, of course, in our platform as well, and we have implemented it in several parts, are continuing to use it. But what we've also been seeing is that it can be dangerous to rely on the data, because what we're seeing, for example, when we're trying around text generation, making recommendations, that it all looked amazing, it sounded pretty well. There's great sources and studies at the end of the articles that ChatGPT generated for us. But then when we checked, it was actually just no. These studies didn't even exist. So the AI was hallucinating and just making up stuff. And where do you see the risk of now there's so many companies and people starting to use AI in their products and in their services, while at the same time we don't even know if we can trust everything that we see and where we can see the output. So that can also cause a situation where we're suddenly relying on information or on data which has been hallucinated by AI and is not really true. So how do you see that risk, and how do you mitigate it when you work with your clients?
Yeah, so this technology is evolving very fast. Yeah, so I think the OpenAI ChatGPT, version where you don't see any sources and it really is hallucinating some sources, even law cases in the US have been made up, so by the machine, basically. Yeah, so this is a barrier which will be overcome pretty soon. So now there are large language models available where you can then see the source of the generation itself. Yeah, I think there will be very specific language models in the future. So because training time is down from 1.5 years down to 20 days roughly. Yeah? So you still need the heavy infrastructure to train a language model, but you don't have to train it for 1.5 years anymore. So we see, for example, in the financial services industry, there's a Bloomberg GPT, which is a financial data and financial information large language model. Yeah, so I would see the same for the health and life sciences industry in the future. So because it will be, it will be more specific. It will be trained on just the content you want to have it trained on, and not on the World Wide Web knowledge, so to speak. So I think technology is evolving, and so I would, most of my clients start to embrace the technology and try it out and play around with it, but they don't make a platform decision yet. They don't say, yeah, let's all put it on the Microsoft Azure OpenAI platform, so as an Azure instance. So let's test other language models as well, and there's a lot of research going on for very specific language models, which will then be also be able to really then also quote the sources, so which will then overcome all these barriers. Yeah? So, but I agree, I would not rely on a documentation from ChatGPT+.
Okay, wonderful. Martin, thank you so much for taking the time and sharing your very personal insights. If there's any questions after this conference, then I hope it's okay then if I forward your contact details, and then people can reach out to you about this topic. So thank you very much. Cheers back to Switzerland, and
live long and prosper.
Have a great day. Thank you.